Welcome back to the Relationship Blueprint. Thank you for your feedback asking more about sex and intimacy. And I also heard from listeners that they loved the relational contract episode with Dr. Patterson, but they wanted some examples of what that really looks like in a normal conversation. So, with my amazing guest today, I'm going to ask her if it's okay that I do some modeling with that idea of relational contracting, because really, Linda and I are going to be in a relational conversation, and I'm going to need to do some of that to make sure that what I'm asking her is fair. Or if she wants to renegotiate it, she may tell me, no, that won't work for me, Colleen or Coco. She calls me Coco. That won't work for me because, and then we renegotiate it together. So hopefully we can help people get an even deeper understanding of relational contracts. Uh,
Wonderful.
so today we're going to focus on our guest and all that she brings to the world of relationship. It's a mystifying, baffling, and exciting adventure of relationship. And Linda Lewter is a licensed professional counselor specializing in Imago Therapy. She serves on the faculty of Imago International Worldwide, the Training Institute. She is also a co-author of Black Therapists Rock, A Glimpse Through the Eyes of Experts. So she's all these things, an excellent therapist, an inspiring educator, and an author. But she's also my friend. And I'm really happy that she agreed to come and join me today. Hey, Linda.
Hi. Thank you for having me, Coco. It's such a pleasure to be here.
I know, I'm really glad we're getting to do this together. Linda and I were in a consultation group for a while together, and I had such a great opportunity to get to know you. And then also at our international faculty meeting this spring. So that was fun. So I'm
Yes.
glad. Is there anything when I introduced you, Linda, that I didn't tell our listeners that you would like to add about you?
Yes, the only thing I would add is along with my longevity in the counseling community, 19 years at this point, 19 years professionally, because that's when I finished from Regent University. But counseling is something that I've been around all of my life because my mother was kind of the neighborhood counselor.
Oh, I
People
didn't know
always
that.
sought her out,
Huh.
for advice. So I'd always been around that. And then she was an evangelist. So people were always seeking her out, even in churches and things of that nature. She wasn't a pastor, but, almost feel like what they call it, a pastor's kid,
Yeah.
because I was around the ministry. So all of my life, basically.
Wow. I
Um,
didn't know. I really didn't know that about you and how early your training was, to be the pastor's kid and to listen to your mom, who everyone sought out, and you got to watch that.
Yes, yes. My mother wasn't a pastor, she was an evangelist, but she was right there with the pastor,
Yeah.
doing a lot of pastoral duties, per se.
That
So,
is exciting.
yes, yes, I do
You
have
can't
that
buy
background
that training, can you?
at all, at all. And that really greatly influenced me in choosing going into counseling.
It's so interesting why we go into this field. I think our listeners are always fascinated or maybe even surprised to hear a therapist's story.
Mhm.
That sometimes I've heard people say that they think that we just have this all together and that's why we went into this field. But there's all of these different reasons that bring us into the counseling field.
For
And
sure, for sure.
I know I had a lot of family members with mental health issues. And I think it
Mm,
always was such a mystery to me. Like I wanted to
mm,
understand what
mhm,
it was like going on with them at an early age.
mhm.
So yeah, I'm excited to learn your story because I didn't know that about you.
Wow, wow. Another thing that I kind of bring that is a little different sometimes when people hear. So my first career was actually accounting. I was an accountant, an auditor actually for the government for 15 years.
What a
Um,
big shift.
big shift, big shift. So, the story that people don't know is that when I was in high school, when I was trying to decide what I was going to do, I was always torn between psychology and something more substantial, concrete, accounting. So what I researched about the accounting path, I felt like, you know what, I can go get a 4-year degree, be off and running in my career, and have some independence. The psychology, because I didn't have a lot of exposure to um, psychologist, a counselor, anyone that was more vague. The story that I told myself is if I go into counseling, I'm probably going to want to go all the way. I was thinking at the time to the doctorate level,
Uh-huh.
because that's just whenever I start something, I want to go all the way to the end of it because I want to have plenty of options. So I thought if I go counseling, I have to go into my doctorate. That's going to take too long for me to gain my independence.
Yeah.
Accounting, I can do 4 years of accounting, and then get my CPA, which I did.
So can I mirror you on that?
Sure.
I want to make sure I got it. So really, you had been torn between counseling and something. I think it was interesting that you said something more like concrete, like accounting, and counseling seemed like you only could do the big long road PhD, and then you wouldn't have your independence as soon as you would if you did accounting. And so that you went that route. But you also said something really important, that you didn't really see therapists, psychologists, psychiatrists. You didn't live in a world where that was a lot, you had a lot of exposure. So it
No
was
exposure.
no
None at
exposure.
all. I had no idea of what that world looked like because
Yeah.
that's not something that I was exposed to. That not something that we did.
Yeah, and so if children aren't exposed to these other choices in life, they never even really think about what they can do, what's possible for them. So that kind of does really circle right back to the heart of what I wanted to learn from you today, Linda, is and I first want to ask the question because I am aware that this is an important question. Do you prefer the term Black or African American?
Either one, I really don't have a preference. African American, Black, either one is fine. I guess African American has been more adopted, but it just depends on the season and the crowd, but
Well, what do
I'm
you like?
I'm flexible. African
Okay.
American,
So
like
for
it's
you,
interchangeable for me. It
okay.
really is.
All right. So is what the story that I'm in is that that if I'm going to be culturally competent, that I need to ask people what they prefer. Is that accurate?
I think that's fair because everybody is different. I definitely don't speak on behalf of the African American. We'll go with African American. I don't speak on behalf of the African American because there's so much variety. So, for this conversation, I think African American, it recognizes that Africa is, um, you know, probably where my heritage, even though I didn't come from Africa, I'm from America very much, but I'm very American because this is where I come from. This is all I know.
It's interesting, Linda. You may not know this about me, but I moved to South Carolina at 23, so I've been here 40 years. And then I live in Hilton Head, South Carolina, which is very heavily populated by the Gullah culture. And I'm not sure if you're familiar with Gullah,
I have
West
heard of the
African.
Gullah. Hmm.
Okay, so I've had the opportunity in my lifetime to really live in a region where being African American and the heritage is honored and valued. And so that's a pretty cool thing about where we live. And I think that that is part of our community's, maybe, I don't know, just mutual respect.
Hmm.
Um, and I'm not going to pretend that I as you said, Linda, there's no way that you and I are going to have this conversation today and perhaps not step on some toes. So I know that you're not trying to
Right.
speak for all African Americans, and I'm
Exactly.
certainly not
Exactly.
going to speak for all white people.
Right. Right.
But
Just
we're
our
going to do the
personal
best we can.
experiences. Yes.
Does that sound good?
Sounds great. Sounds great.
Yeah, because if there's anybody I feel safe exploring this with, it's you.
Thank you.
I feel like you're going to give me the permission to make some mistakes, and I give you the permission to correct me because I want to learn.
For sure.
I want to do better.
Yeah, I feel that.
So, would you mind if I read you some statistics about
Please.
counseling? Yeah,
Mhm.
I wanted to update like what I really knew as far as facts, and because we have a national problem with people getting accessing mental health.
Mhm.
So 20% of all Americans, it's actually like 21.8, have a diagnosable mental disorder. And that's 1 in 5 people.
Mhm.
And for our viewers, that means ADHD, it means mild depression, it means chronic depression, it means um, autism. It covers so many things that people think sometimes when they hear mental disorder, they're thinking schizophrenia or borderline personality disorder, narcissism. Like all of these things are true, that's part of a whole list of 465 mental disorders. But we're talking about a large part of our population. So we start there. And then 5% have serious mental disorders. And we're talking about people who, really have hallucinations. They're not, that they really need such serious treatment. So we have
Mhm.
20 and 5. That's a
Mhm.
big group, right?
Yeah.
And then what number of people access help?
Hmm.
So we have 18.6 of non-Hispanic white people seek help. So let's just say mostly white people in America, close to 20%
Mhm.
of the 20% that need help seek help. Not
Mhm.
very many.
Mhm.
And here's where it gets really concerning for
Mhm.
me, but if that's not enough of a concern,
Yeah.
8.7% of Hispanic or Latino people seek help, and 8.3% of African Americans seek help.
Mm.
And ironically, men are typically 1/3 of any practice. So men are also underserved
Mhm.
for mental health.
Mhm.
Now, do you have anything you want to add to that? I mean,
No, that
from from your practice, what you see as far as like people willing to come in and get help.
I think those numbers on a, I guess, national level sound pretty accurate. What I've found is, I think in this day and age, people want to go to someone who looks like them. So when I find myself in various practices, my own practice, when I've been associate with others, um, I tend to get a lot of requests, people seeking me out because I am African American. And oftentimes when these people come in, ask them, "How did you find me?" Especially my private practice, and they say, "Well, we Googled you, and we saw your picture,
Oh, yeah,
and and I just felt like you could help me." And a lot of time is because I look like them in a sea of possibly pictures of people who don't
yeah.
look like them.
That's so important in the sea of pictures of people who don't look like them. And
Hmm.
you're so right, Linda. I didn't check this statistic. It would be an interesting one, but how many licensed therapists are white and how many are black and how many are Latino? I mean, that's a
Hmm.
interesting stat I'd like to follow up and check out. So yeah, so that if they're seeking you out because you look like them, but I'm also underlying underneath that is what? Why else do they want you? And I'm not saying they don't want me, but why would they choose you and not
No,
me? Right?
totally understand. Trust.
Trust.
That's part of why they're looking for someone who looks like them is trust and understanding.
Mm-hmm.
If I look like them, at least the underlining thought is that I won't have to explain some of the unspoken thoughts and ideas and things within our culture. I don't have to educate someone on my culture to be able to understand me.
Yeah.
She looks like me, so there's a chance that she understands where I'm coming from.
Yeah, and then they can get right to their problem instead of trying to
Exactly.
educate the therapist. Or maybe even, would you say, even maybe in your own experience of therapy, that as an African American woman, and say you have a white therapist or even a white professor,
hmm
that there's I don't know, would it be tiptoeing around some things?
Oh,
Or,
for
yeah,
sure, because that's where the trust element comes in. Um, Number one, not wanting to be judged. So if I share certain experiences, you know, I may be judged by the person who's hearing this.
yeah.
And let's deal with the elephant in the room. When we go back in history, it wasn't safe. It wasn't safe for an African American to be vulnerable about talking about something that's going on in the home,
Can you
you
tell
know?
us more about, I think that's really, really important because I think all clients beginning with a new therapist have trust issues. It takes so much
Mhm.
time to develop that relationship so that you can really kind of spill your story and not feel that any kind of judgment. So that's for any of you looking for a therapist. If you're not feeling that with somebody, you
Mhm.
probably need to move on because 50% of the success of therapy is truly the relationship with the therapist. So
It's
that
true.
variable alone is a big deal. And so what Linda's highlighting for us is that people of color want to like at least not have the color barrier be in the way before they even get started.
Exactly.
Yeah.
Exactly. Well, it goes back to well, before the famous Vegas line, what happens in Vegas stays in Vegas. As an African American, and I'm going to generalize here, there's a statement that I think a lot of us have heard about what happened. You don't go out and tell people in the street what's happening at home. And whenever I think about that, I think about this old movie. It was with the recent passing of James Earl Jones. He was in a movie in 1974. I looked it up. There was a movie called Claudine, 1974. And in this movie, so it was this maid, and she had six kids, and then she met this gentleman, James Earl Jones, and he expressed interest. So now they're dating, but it highlighted the fear and the problem with this man now coming into that home. Now she was because I think someone from the welfare office would often come around, make these visits, looking around to see if she's buying new items, you know, seeing if someone is living there. So now it became a liability. A man has come into her life, and it was a liability because now she was um that was a threat to her food stamp. She had six kids, so she needed these services along with whatever she could do on her own. But now, if they sensed that there was a man in the picture, she would be penalized. They would take her and this man. So she was working as a maid. He was a working as a sanitation worker. So he wasn't making that.
Yeah.
He was probably doing okay. Um, but they were going to substantially, risk taking her food stamps and whatever supplements because there was a man in her life. So the point that the movie kind of made is that it was seen as it was something that you fear. Having the family was not promoted. It was almost, if the promotion from the government was, do not have a man in your life if you want to keep your benefits.
Right, right. And here she
S-
is with 6 kids by herself. And then, the whole idea of, I mean, when you were talking about historically, I was thinking way back, like when Black people spoke, what happened to them,
Exactly.
you know, about anything.
Hmm.
Who could you talk to and trust?
Yeah, because people would use it against you. They would use it to, if you, especially if you got vulnerable, they would use that as manipulation. They could possibly manipulate you with that. And then it was just that lack of trust that African Americans had when it came to the medical field. We all have heard about the Tuskegee experiment, and I think it was the other one where they used somebody's DNA, this lady's DNA, and it didn't tell the family without permission, and came up with, I think, some vaccines and things. So it seems like we had always been manipulated or used, or so the medical field, didn't seem like a safe place. And medical worker, social workers, these people were not safe, because you could misspeak about something, and who knows, someone could show up at your door and take your kids,
Yeah.
because they deem that, especially if you casually said, "Oh, I had to, beat." So the term was beat. It was like, "Oh, I had to beat so and so because they acted out." Oh, well, if someone heard that beat, you had to beat a child, you know, that could get all of your kids taken away from you, and you may be put in jail. But we may use that term beat, but it was more of a spanking. It
Uh-huh.
was just more of a discipline. It wasn't like I was beat with a. Now, some people were, and that's where the problem was, because some people were actually beaten with
Yeah.
extension cords and irons and things that was really child abuse. But there's a fine line between discipline and child abuse. Two different things. But
Yeah.
sometimes we might use the same term, but it doesn't mean the same thing. It really have to look at a case by case. There's a lot of factors that you need to look at.
But what you're also really highlighting is that the systems in place, whether it would be, the Department of Social Services protecting children, or schools, the police force, medical professions, there was a real fear among African Americans to really seek help, because seeking help didn't always end in a way that made people feel better or help their lives. It sometimes turns against them. And so when those systems are not safe, then who in their right mind would seek help? It's easier to
Exactly.
stay in the family, don't talk to people. We should, and let me check this out. I believe, and I grew up with single mom and a grandmother who was a widow, and
Hmm.
neither one of them graduated from high school.
Hmm.
And they both were really, really hard workers. So although I never suffered from food scarcity, I
Hmm.
did, we struggled economically.
Hmm.
And so when you were talking about what you were exposed to, I was thinking about how little I was exposed to as far as being around psychologists, counselors, therapists, and really didn't have a grasp of that either. And our messaging was stay in the family too. And I don't
Hmm.
really know. I mean, I think it was, the old Irish that came over and
Hmm.
didn't really believe, unless you were seriously ill, that you
Hmm.
didn't need help. And goodness gracious, they needed help, Linda.
Hmm.
I
Hmm.
mean,
Hmm.
my
Hmm.
my mother, she had borderline personality disorder, and never was really able to get the help she needed.
Hmm.
And my
Hmm.
grandmother suffered from, really
Hmm.
depression, and she was actually hospitalized in her 30s. So that's for another episode.
Hmm.
But that idea of getting help, even in my culture, was
Hmm.
it was not encouraged the way I
Hmm.
see us moving forward today.
Right. So what I'm hearing you say is that this may not have just been an African American or people of color thing. Were a lot of families where this concept of don't talk about what's happening at home out in, in open spaces. However, one might have been driven by maybe pride or ego, whereas the other it was actually dangerous.
Absolutely, Linda, you nailed it. I mean,
Mm,
my situation was all about pride. We don't want
mhm.
everybody to know what's going on in the house,
Right.
and we can take care of this. And you're right, it was all pride driven, absolutely. And it wasn't
Mhm.
about fear. You're absolutely
Right.
right.
But
It's a
ours
huge
was fear,
difference.
yeah, that the family would be disbanded,
Yes,
that people would, end up with legal problems
yes,
that they never be able to get away from.
yes.
So the consequences were so steep.
Absolutely.
Mhm.
And I think it's a really good differentiation that you're making because I have had conversations with colleagues and friends trying to help people understand that the Black experience is not the poor Irish experience. And I think that that's a really big misunderstanding in our
Mhm.
country
Mhm.
culturally. And when people sort of get stuck on that needle, then they stop learning there. They want to
Exactly.
keep it like somehow, well, I was Irish, I was poor, my parents came over during the potato famine. So why didn't the Black people do the same thing? Right.
Right.
Can you help our listeners? Like, I know it's a longer conversation, but
Mm.
just helping our listeners understand what that difference really is.
Well, it's here's how I think about it. During the summers here in the Hampton Roads area, we have a lot of festivals. We have the Greek festival and this a lot of heritage festivals. And when I've gone to, especially a Greek festival that I went to this Greek festival, and it was not only the food, Greek food, which I love, the gyro or gyro, however you say it.
Yeah, yeah, yeah.
And the dancing and some of the thing programs that they had going on was about carrying forth the history. Even in the dances, when they explained the dances, they were talking about the history, of their heritage, and things of that nature. So even though people came over here under dire situations, they might have come over as a family and they struggled as a family, you know what I'm saying? And
Yeah.
even if they didn't have anything, they maybe at least had each other.
Yes.
Maybe one person
Absolutely.
came over and they were able to maybe couldn't even come over all at the same time, but one person came and then they sent money back, and but they were still a unit
Yes.
regardless of what it looked like.
Right.
That's where it ends for this is the problem for the African American family. When we Number one, when we came over, it wasn't voluntary. We weren't, oh, I'm going to seek out a new world for opportunity. We were stolen from a land. And we might have been stolen as a family, but when we got here, there was a huge, this is where the trauma begins. So when we got here, the trauma begins because imagine that family unit that you talk about had to struggle together with nothing. Well, we came, number one, it was a traumatic situation that brought us here. We were stolen. It wasn't voluntary, but we came as a family all the same. But
Yes.
then when we got here as a family, the emotional trauma that we experienced by the separation, now we came as a family, but now I have to watch my husband humiliated, tortured, and forcefully taken from the family, or vice versa. And the most, I don't think we've seen a movie. I've never seen, and I'm one I like to watch. I know I'm maybe odd. I like to watch slave movies about slavery and the history because, I'm hoping that finally I'll see something with a true depiction, but I really don't think I ever will because it was so horrible.
Yeah.
I don't think a movie director would dare touch it, what the African American went through psychologically and physically. There's not a movie out there that touches it to me.
And you're
So now
saying,
this, mm,
oh, no, no, please continue.
yeah.
I'm sorry.
So now this family, not only the effect of the psyche on the male watching the horrendous things done to his wife, but the wife watching her strong husband, watching him brought to his knees, because we know one of the things was, let's pick the strongest person and let's teach the whole community a lesson by how humiliating can we, make this so that everybody get understands, you better stay in line. And then think about the psyche of the child who has now to be separated. We understand the developmental stages and that the attachment stage, so crucial for the development of the child. Imagine the traumas between 0 and 8, especially between 0 and 8. Imagine, the things that's going on in your body as you're developing have to be exposed to this. So something horrible happened to the family unit. So talk about being able to, well, couldn't you work together and pull yourself up? How?
And I think what you're also saying that's just so important, and we know this from the Holocaust because there's been so much research on this, and also if people are interested to really understand the difference between my ancestors coming here as the Irish whites and Linda's ancestors coming here by force. If you really want to really understand it in a deeper way, there's lots of things that you can read about or look at. One is it called Cast? The is it
Yes,
called Origins?
it's
It's
called Origin by
Origin.
yes, Avernay. Yes.
Yes.
Yes, that
If,
yeah, it's a recent movie. It's called Origin. I think it was 2023. It's
yeah,
called Origin and it's about the caste system. So that's a good start.
it's a good that I would agree that it's a good start
It's a good
because I
start.
really think that we need to maybe as in a country we've got to start in small ways for all of us to be more culturally sensitive, culturally educated,
Mhm.
and just to understand one another. We don't have to agree on everything, but boy, without information, we can't even really make a good decision about how we feel. And
Exactly.
so many of us, including myself, have a lot to learn, you know?
Mm. Mhm. Mhm.
So this generational trauma that you're talking about. So let's go to your clients, my clients. This generational trauma has really impacted our African American community. And can you help us understand? I was looking at my notes. 60%, okay, people of color are 60% less likely to seek couples counseling. So now we're in another area where we have everybody has problems.
Mhm.
Every relationship, as Linda and I well know, starts out in a romantic phase, can't eat, can't sleep, can't stop having sex, to
Yes.
the other stage, which is called the power struggle, where
Mhm.
we all start to really dig in and start to learn about really what am I bringing to this relationship that's getting in the way of our connection? What are you bringing and what can we do about it?
Mhm.
But most of us go into that stage thinking, if you could only change, I could be happy.
Mhm.
So this is what Linda and I do with couples every day. But help us now, given this history, that we can hopefully begin to understand about generational trauma in African Americans. How then, when couples come in or don't come in for help, what does that look like in your office? Can you help us with that?
Well, it's kind of piggybacking on that same, what happens in the home stays in the home. When a couple starts to have problems, um, oftentimes and this is a stereotype, but oftentimes the male may think, I don't want someone, you know, telling us in our business, I don't want to divulge the intimacies, of, you know, things going on between us with some stranger that don't know me. What
Mhm.
can they tell me about me?
Right,
Right. And of course, that is why, that's why we're drawn to Imago,
right.
because, with the type of therapy that we do, we don't we're not focused on the content. We're focused on the how you process that information. But it's that information, it's the content that they don't want people in their business, because of all the reasons that we've said. And here's the other thing is that I think initially, when I think about my parents were born in the early 20s. And I think as forming families was really about survival.
Right, right,
My great great grandfather was probably spent some time in slavery and was part of the first generation because she was a sharecropper. So now he's right there at the time where now slavery has officially ended, but the struggle did not end.
right.
So as a part of survival, now that now we can have a place if we can get it. Your survival depends on how many children you can have to try to run a farm as best as to do your fair share cropping.
Yeah,
So so my dad, there were about 8 of them that lived. And oftentimes in these situations, you have a lot of miscarriages because you don't have good prenatal care. you know so it was at least 8 of them for the purposes of sharecropping. So my father remember having experiencing farming, but as soon as he got up, to the point that he didn't have to do it, he got out of that,
right.
right? So moving forward, the family unit, when you came together, there were certain expectations. It's like you had experienced horrible situations, and if you wanted to have a family, I think it's certain things you just told yourself, this is just how it is. If the prior generation didn't understand what healthy and balanced relationships were, they can't teach it to the ones going forward. So then you start saying things that you just start telling yourself, this is just the way it is.
Yeah.
Why would you expect anything different? Well, this is what men do. This is just how it is. You're, as the female, this is what you just have to be subject to. So a lot of it, there are marital issues, but you feel like, get help. Why? This is just the way it is. You
And
don't even realize that there can be something else.
you're so right. And I think this is cross-cultural, that people really, Maya Coleman, one of our favorite instructors, is such a brilliant woman. And she said most people would rather live in a predictable hell than have a taste of happiness,
Hmm.
because it's really risky, like to do what we know. People don't realize that when they stay unhappy or stay in the status quo, they don't realize that they're staying there in many ways to protect the relationship, because they're afraid if we do something different, if we go there and talk to that lady or that man, then everything's going to blow up. And if we start unpacking that bag, there's no going back. Like if I start telling her how I really feel, then oh shit, right? So I think that one of the things I love about the work that Linda and I do is that men generally come in as the dragee. The
Yes.
wife says, you know what, if we don't go to therapy, I'm not in this anymore, or whatever.
Yes.
And then the man comes and he doesn't want to be there. And honestly, I have never had a male come to my office after a session that didn't say something like, oh, I didn't know it was going to be like this. It's okay. Like, I feel like I got a chance to say how I really feel, and the
Yes.
world didn't end, it's safe. And so I think as we're talking about this, to be fair to our viewers, couples counseling is a specialty.
It is.
And you really want to see someone who knows how to work with couples, because it's just like not being culturally competent.
Mhm,
um, if I'm seeing an African American family and I'm not really keenly aware of what I don't know,
mhm.
I can do more harm than good.
It's true.
And the same way, I think, with people that are not trained in couples work, it can be a bad experience for someone. So I
Mhm,
encourage people to look for a therapist who has, in our case, we love the Imago training, but imagorelationships.org is a great place to find someone. So, what do you say to African American individuals and couples about, getting people to think about mental health differently? What is a message that we can, or is there anything more that we can do as a
mm,
society to
mhm,
help break the stigma?
mm. Well, I like to start with some of the stereotypes. I really love it when I can engage in a conversation with the person and say, well, what might hinder you from getting counseling or talking to someone? And when they say things like, well, because, I'm not crazy. I don't need to be, go to a shrink.
Yeah,
And I said, that's great because um, I don't work with crazy people.
yeah, I love that.
So, we might be a good fit. My clientele are just people like you and me who might be having some struggles, may whatever's happening while life is lifing, maybe you don't have the tools, the particular tool to help you through that thing. That's the people that I see. I see people who need tools to help them to get through the things that sometimes gets in the way of you having of being fully alive.
Being fully alive, I
Mm,
really, really want to focus on that with our listeners, because I goes back to that idea that we'd rather live in this predictable hell
mhm,
than really experience being fully alive and really making each other happier, having a better quality of life, and that it's
mhm.
really possible. Um,
Yeah.
Yeah. And what you're saying is also so important. I mean, that whole idea of people say, I'm not crazy, I'm not going to a therapist, or my marriage isn't that bad. Okay. But what would it be like if it were better?
Mhm.
What if you could stop having that same old argument that you always have that sort of just never really goes away?
Yes.
You just kind of give up on it because you've had it so many times, you figure we're not going to be able to figure this one out.
Mhm,
And really, counseling can help people really not only get past that, but grow from it.
mhm.
So
Yeah. So
that's really,
I try to give people a glimpse of the possible because they don't even know what is possible.
so these people that are listening and they're thinking, I'm on the fence, I don't really think I need therapy. Why would I invest that time and money? What is really like, what are they going to do for me that I can't do for myself? What do we tell them?
You don't know what you don't know.
Don't know what you don't know.
Yeah, I tell people, are they familiar with the definition of insanity? Because it's doing the same thing, over and over again, expecting a different result. That's the definition of insanity. So if you think there might be something out there different, just try it. Just try. If you don't like it, it's not a lifelong commitment. If you try a session with someone and it doesn't work out, I tell people no harm done. Just don't go back.
And Linda, where can people find you? How do they locate you?
The easiest way to find me is just my website. If you just Google my name, Linda Luter, I'm sure a lot of things might come up, but lindaluterassociates.com will get you right to my website. And then you got You'll see everything that I'm doing. You'll see my coaching. Now I mainly in my private practice, I do a lot of coaching intensives. Intensives are I spend 2 days just with one couple. I do workshops. That's with a group of people. It's not group therapy. It is, I take a group of people, I give them a lot of psychoeducation, and I give them an opportunity to practice some of the things that I teach them in a very private, confidential way. But I am on hand if they run into trouble.
So what Linda's talking about is called the Getting the Love You Want workshop. And you can look that up again at magorelationships.org. You can look at Linda's website. You look at my website. But I think what you need to know about that is if you're a little tentative about going to therapy, highly suggest the workshop because it's like 6 months of therapy in a weekend, even though it's not therapy.
It's not
And
therapy.
you never have to say anything out loud at this workshop. Like if you're a
You don't?
person who's very private, you don't have to share, you don't have to volunteer to demo. I once had a couple at my workshop that didn't talk the whole time.
Mhm.
And I thought to myself, gosh, I want to check back with them because they weren't clients. They just signed up.
Right.
So after the workshop, I called the wife and I said, I'm just curious how you felt about the workshop. I didn't really know if you were getting what you needed. And what she shared was so amazing about how it changed their marriage and they were about to get divorced. I didn't have any of that history, right?
Mm.
But that's just the evidence that you don't have to air your laundry if you don't want to do that. Some people really like to share in a group and some people don't. And
Exactly.
either is just
Yeah.
fine.
Mm.
But that before you even start therapy will make everything go like clockwork. So the
Oh, yeah.
workshops are highly
Mhm.
recommended.
It will refine your therapy because it will just, I tell people it's really about clarity. What you get from the workshop is clarity. Now, if you then decide to seek therapy, now you can be more focused in what you need to work on. And one of the bigger differences in how we do what we do is the paradigm between the medical model and the relational model. And the relational model, this paradigm is what most of the, especially the African American men that I find really love. And that is the idea that in the medical model, you go to an expert to fix your problem. In a relational model, you don't go to someone to fix you, it's a collaboration. So I tell people we're both going to bring something. I'm going to bring my training, my education, my expertise. That's what I'm going to bring. And I'm going to come prepared. What they're going to bring is an expert knowledge about themselves and what they want and about their relationship. And but with those two things, I think we can get somewhere.
Linda, that is such a great description of how it works and really, really highlighting again for our listeners. Most therapy is a medical model. You're kind of assessed. There's a lot of forms to fill out. You get a diagnosis. They work on the treatment plan. And Imago sees all of us as, these wonderful human beings that all go through life, and life happens to us sometimes. And
Mhm,
that causes some symptoms, if you will. But we don't really like to diagnose people. We like to look at how is this showing up in our relationship? The
mhm,
fact that when I get really, really hurt, I shut down and don't talk.
mhm,
And then my partner never knows when I'm going to talk. And then the partner really gets anxious because not knowing what's going to happen or when we're going to reconnect creates this real distance between us. But that's all relational. And that's what Linda's highlighting for us is this relational model that
mhm.
if you're a human being, you're in relationship.
That's it.
And Harville Hendricks, the founder of our theory, always says, we're born in relationship, we're wounded in relationship, and we're healed in relationship.
Yes,
And
yes.
I want to thank you so much for joining me, Linda. I feel like we could talk forever on this topic
Good.
and learn so much more from you about what you have to share about cultural competency for therapists,
Yeah.
how African American people can seek the right help,
Hmm.
feeling safe about getting help.
Hmm.
And I just really encourage everyone who is listening, whether you're African American, Hispanic, white, uh, Pakistani, whatever, we're human.
Yes.
And as a human, we suffer.
Yes.
And let's let the suffering be less. Thank you for joining us on the Relationship Blueprint. We're here to help you unlock your power of connection. And we'll see you next time. I think we're going to talk about money. So,
Mm,
money and relationships.
a good one.
And all right, Linda, thanks again for being with me.
Thank you. Thank you
All
for
right,
having me.
I appreciate it. Hey, Linda.
Hi.
Hey, I heard you're doing a training. Does it start in November?
Yes, it starts November the 7th. So it starts on a Thursday, Friday, Saturday, and Sunday.
All right.
So the
And this
7th through the 10th.
And this is Imago Clinical Training. Can you tell me a little bit more? What do I get if I'm a therapist and I want to work with couples, but I really, gosh, it's so hard because there's
Mhm.
so much to manage when they come in and they want me to fix them. What does this training help me do as a clinician? What will I learn?
So as a in this training, you will learn how to be more relational. Most of our theories are based on the medical model, but Imago is more relational. So you will learn how to build a, collaboration with your couple. You know, let the couple be an expert on them. You'll bring your clinical and tools, and you won't have all that pressure of sometimes therapists feel like, ooh, like it's game on, or the show is all on you, and what will I do? And there's all this anxiety. Imago helps to take all of that out of that.
So what I'll get really is some tools and techniques that will make it less about me and more about the couple.
Yes, you said
Sign
it
me
perfectly.
up.
You
That
got it.
sounds great.
You
Oh,
got
thanks
it.
so much for being with me today, Linda.
No problem.
So, Linda, where do I learn more about your training?
Go right to my website. It's lindaluterassociates.com, and
All
you can
right.
find everything that you need to know right there.
And if I have any questions, can I call you?
You can reach out to me. Reach out to me through my email, lindaluterlpc@gmail.com.
All right. Looking forward to it. Anyone who wants to work with couples and really wants to feel like they're competent in your room and be able to really make a difference with couples and relationships, this training is not to be missed.